Mental health. Two words that can spark fear, judgment, and uncomfortable silence. We are often obsessed with picture-perfect lives, and mental illness is often swept under the rug. We treat it like a dirty secret, something to hide away. But silence can be deadly. Mental health stigma, the negative attitudes and discrimination surrounding mental illness, is a global crisis. It impacts millions. Oftentimes we admonish others to snap out of it when actually battling depression. Picture being denied a job because of a past diagnosis. Sickening. This is the reality for countless individuals facing mental health challenges. Stigma thrives in the shadows, fueled by misinformation and fear. It prevents people from seeking help, pushing them further into isolation and despair. The World Health Organization estimates that nearly 2/3 of people with a known mental disorder never seek help from a health professional at all. Why? Stigma plays a significant role. The fear of judgment, discrimination, and rejection can be paralyzing. This silence has devastating consequences, leading to worsening symptoms, increased risk of suicide, and a decreased quality of life. We must break the silence. Mental illness is not a weakness, it's a health issue. It's time to treat it as such. Mental health is a topic that often evokes a range of emotions. For some, it brings to mind personal struggles or the challenges faced by loved ones. For others, it may be a subject shrouded in mystery and misunderstanding. The stigma surrounding mental health is pervasive and deeply ingrained in our society. It manifests in various ways, from casual remarks that belittle someone's experience to systemic barriers that prevent individuals from accessing the care they need. This stigma is not just a social issue, it has real, tangible effects on people's lives. In today's digital age, social media often exacerbates the problem. Platforms filled with curated images and highlight reels can create unrealistic expectations and contribute to feelings of inadequacy. When everyone else seems to be living their best life, those struggling with mental health issues may feel even more isolated and ashamed. The pressure to present a perfect facade can be overwhelming, leading many to hide their struggles and suffer in silence. The act of sweeping mental illness under the rug is not just a metaphor, it's a reality for many. Families, workplaces, and communities often prefer to ignore or downplay mental health issues rather than confront them head-on. This avoidance only serves to perpetuate the stigma and prevent meaningful conversations from taking place. It's a cycle that needs to be broken. Treating mental health like a dirty secret is harmful. It sends the message that these issues are something to be ashamed of, something to be hidden away. This secrecy can prevent individuals from seeking the help they desperately need. It can also lead to a lack of understanding and empathy from those around them, further isolating the person in need. The consequences of this silence are severe. Mental health stigma can lead to a range of negative outcomes, from worsening symptoms to an increased risk of even suicide. When people feel they cannot talk about their struggles or seek help, they are left to cope on their own. This isolation can be devastating, leading to a downward spiral that is difficult to escape. The impact of mental health stigma is not limited to individuals, it affects entire communities. When people are afraid to speak out or seek help, the burden on healthcare systems increases. The lack of open dialogue and understanding can also lead to a lack of resources and support for those in need. This is a global crisis that requires a collective and urgent effort to address. Picture being told to snap out of it when battling depression. This dismissive attitude is all too common and can be incredibly damaging. It minimizes the person's experience and suggests that their struggles are not valid. This kind of response can deter individuals from seeking help and make them feel even more isolated. Some people are even denied a job because of a past diagnosis. Discrimination in the workplace is a significant issue for those with mental health conditions. The fear of being judged or treated unfairly can prevent individuals from disclosing their condition or seeking accommodations. This can limit their opportunities and contribute to a cycle of poverty and instability. This is the reality for countless individuals facing mental health challenges. The stigma they face can be a barrier to living a fulfilling and productive life. It can affect their relationships, their careers, and their overall well-being. This is not just a personal issue, it's a societal one that requires collective action. Stigma indeed thrives in the shadows, propelled by fear and misinformation. The lack of accurate information about mental health can lead to misconceptions and prejudice. This fear and misunderstanding can prevent people from seeking help and contribute to a culture of silence and shame. Misinformation and fear are powerful forces that can shape public perception and policy. They can lead to harmful stereotypes and discriminatory practices that further marginalize those with mental health conditions. It's essential to challenge these misconceptions and promote accurate, compassionate information about mental health. The fear of judgment, discrimination, and rejection can be paralyzing. It can prevent individuals from reaching out for help, even when they know they need it. This fear can be a significant barrier to accessing care and support, leading to a worsening of symptoms and a decline in general health. The World Health Organization estimates that nearly 2/3 of people with a known mental disorder never seek help from a health professional at all. This statistic is a stark reminder of the barriers that stigma creates. It highlights the urgent need for change in how we approach mental health care and support. Stigma plays a significant role in preventing people from seeking help. The fear of being judged or discriminated against can be overwhelming. It can make individuals feel that they are better off suffering in silence than risking the potential consequences of speaking out. This silence has devastating consequences, leading to worsening symptoms, increased risk of suicide, and a decreased quality of life. When people feel they cannot talk about their struggles or seek help, they are left to cope on their own. This isolation can be devastating, leading to a downward spiral that is difficult to escape. The consequences of this silence are severe. Mental health stigma can lead to a range of negative outcomes, from worsening symptoms to an increased risk of suicide. When people feel they cannot talk about their struggles or seek help, they are left to cope on their own. This isolation can be devastating, leading to a downward spiral that is difficult to escape. We must break the silence. Mental illness is not a weakness, it's a health issue. It's time to treat it as such. We need to create an environment where individuals feel safe and supported in seeking help. This requires a cultural shift in how we view and talk about mental health. It means challenging stigma and promoting understanding and empathy. Mental illness is not a weakness, it's a health issue. It's time to treat it as such. We need to create an environment where individuals feel safe and supported in seeking help. This requires a cultural shift in how we view and talk about mental health. It means challenging stigma and promoting understanding and empathy. It's time to treat it as such. We need to create an environment where individuals feel safe and supported in seeking help. This requires a cultural shift in how we view and talk about mental health. It means challenging stigma and promoting understanding and empathy. Together, we can make a difference. Together, we can break the silence and create a world where mental health is treated with the same importance and compassion as physical health. Stigma is insidious. It creeps into our lives in ways we often don't even notice, embedding itself in the fabric of our daily interactions and societal norms. It's not just a word, it's a force that shapes perceptions and behaviors, often without us realizing it. It seeps into our lives through casual comments, stereotypes, and discriminatory practices. These seemingly innocent remarks and actions can have profound effects, reinforcing harmful beliefs and attitudes. In social settings, a joke or a passing comment can perpetuate negative stereotypes, making it harder for those affected to feel accepted and understood. We hear whispers like they're crazy, or they're just seeking attention. These whispers, though quiet, are powerful. They echo in the minds of those who are struggling, amplifying their sense of isolation and unworthiness. Gossip and rumors can spread like wildfire, further entrenching stigma in our communities. Or it's all in their head. Such dismissive attitudes invalidate the very real experiences of those living with mental health conditions. They create an environment where people feel they must hide their struggles, fearing judgment and rejection. This dismissal can come from friends, family, and even healthcare providers, making it even more challenging to seek help. These seemingly harmless words carry weight, often more than we realize. They can cut deep, leaving emotional scars that are difficult to heal. The pain of stigma is not just emotional, but can also manifest physically, affecting one's overall well-being, reinforcing negative perceptions and perpetuating harmful stereotypes. This cycle of negativity can be relentless, making it hard for individuals to break free from the chains of stigma. It affects how they see themselves and how they believe others see them, often leading to a diminished sense of self-worth. The media often portrays individuals with mental illness as dangerous and unpredictable, further fueling public fear and misunderstanding. Sensationalized news stories and dramatic portrayals in movies and TV shows contribute to a distorted view of mental health, making it harder for the public to understand the true nature of these conditions, further fueling public fear and misunderstanding. This fear can lead to avoidance and exclusion, with people distancing themselves from those who are perceived as different. It creates a barrier to empathy and connection, making it harder for individuals to find the support they need. This constant barrage of negativity creates a culture of silence. People become afraid to speak out about their struggles, fearing the repercussions of being labeled or judged. This silence can be deafening, leaving individuals to suffer in isolation. People living with mental illness fear being judged, ridiculed, or ostracized. This fear can be paralyzing, preventing them from seeking the help they desperately need. It can affect every aspect of their lives, from personal relationships to professional opportunities. They internalize these messages, believing they are flawed or broken. Shame takes root. This internalized stigma can be one of the most damaging effects, leading to a cycle of self-blame and hopelessness. It can erode self-esteem and make recovery seem like an impossible goal. They retreat inward, hiding their struggles from family, friends, and even healthcare providers. This withdrawal can lead to a lack of support and understanding, making it even harder to cope with their condition. It can also prevent them from accessing the resources and treatments that could help them improve their quality of life. The workplace can be a particularly challenging environment for individuals with mental health conditions. The pressure to perform and the fear of being judged can create a toxic environment. Many feel they must hide their struggles to avoid being seen as weak or incompetent. Disclosure is often met with skepticism, prejudice, and career setbacks. This can lead to a lack of accommodations and support, making it even harder for individuals to succeed in their roles. The fear of negative consequences can prevent them from being open about their needs. The fear of being perceived as unreliable or incapable prevents many from seeking the support they need to thrive in their careers. This can lead to burnout and decreased productivity, further perpetuating the cycle of stigma and misunderstanding. This silence is not golden. It is suffocating. It stifles growth, healing, and connection. It prevents individuals from reaching out for help and finding the support they need to recover and thrive. It prevents open dialogue, understanding, and ultimately, recovery. Without open conversations, misconceptions and fears remain unchallenged. It is through dialogue that we can begin to break down the barriers of stigma and build a more inclusive and supportive society. It's time to challenge the whispers and replace them with voices of compassion, empathy, and support. By speaking out and sharing our stories, we can create a culture of understanding and acceptance. Together, we can break the silence and build a world where everyone feels valued and supported. The consequences of mental health stigma are far-reaching and devastating. This stigma, often rooted in misunderstanding and fear, can prevent individuals from seeking the help they desperately need. It creates an environment where people feel ashamed of their struggles, leading them to hide their pain and avoid reaching out for support. When individuals are afraid to seek help due to shame or fear of judgment, their conditions often worsen. This fear can be paralyzing, making it difficult for them to take the first step towards recovery. They may worry about being labeled as weak or crazy, and this can prevent them from accessing the resources that could help them heal. Untreated mental illness can lead to a downward spiral, where symptoms become more severe and harder to manage. This can result in a loss of hope and a feeling of being trapped in a never-ending cycle of suffering. The longer the illness goes untreated, the more difficult it can be to find a path to recovery, impacting every aspect of a person's life. Their ability to function at work or school can be severely compromised, leading to poor performance and increased stress. This can create a sense of failure and further exacerbate their mental health issues. Relationships suffer as individuals isolate themselves, withdrawing from friends and family. They may feel like a burden to their loved ones or fear being misunderstood, leading them to push people away. This isolation can deepen their sense of loneliness and despair, pushing away loved ones out of fear of burdening them or being misunderstood. This can create a vicious cycle where the lack of support leads to worsening symptoms, which in turn leads to further isolation. The emotional toll on both the individual and their loved ones can be immense. The ability to work or study is often compromised, leading to financial instability and a loss of independence. This can create additional stress and anxiety, making it even harder for individuals to manage their mental health. The fear of losing their job or failing in their studies can be overwhelming, leading to financial instability and a loss of independence. The financial strain can make it difficult to afford treatment, creating a barrier to accessing the care they need. This can lead to a sense of hopelessness and a feeling that there is no way out of their situation. The risk of self-harm and suicide increases significantly when individuals feel hopeless, alone, and unsupported. The weight of their struggles can become too much to bear, leading them to believe that ending their life is the only way to escape the pain. This is a tragic outcome that can be prevented with the right support and intervention. When individuals feel hopeless, alone, and unsupported, the feeling of being trapped in their own mind can be overwhelming, and without a support system, it can be difficult to see a way out. This is why it is so important to create an environment where people feel safe to seek help. Stigma also creates barriers to accessing quality mental health care. Many people face long wait times, inadequate insurance coverage, and a lack of available resources. These barriers can make it difficult for individuals to get the help they need when they need it. Limited resources, long wait times, and inadequate insurance coverage are ongoing challenges. These issues can create a sense of frustration and helplessness, making it even harder for individuals to seek help. The healthcare system needs to be more accessible and supportive to those in need. In some cultures, mental illness is highly stigmatized, leading to discrimination, social exclusion, and even physical abuse. This can create a hostile environment where individuals are afraid to speak out about their struggles. The fear of being ostracized can prevent them from seeking the help they need, leading to discrimination, social exclusion, and even physical abuse. The impact of cultural stigma can be profound, affecting not only the individual, but also their family and community. It is important to challenge these cultural norms and create a more inclusive and supportive environment. The price of silence is steep. The emotional, physical, and financial toll of untreated mental illness can be devastating. It is a burden that affects not only the individual, but also their loved ones and society as a whole. It's a price paid not only by individuals living with mental illness, but also by their families, communities, and society as a whole. The ripple effects of untreated mental illness can be far-reaching, impacting everyone around the individual, but also by their families, communities, and society as a whole. We must break the silence, challenge stigma, and create a world where seeking help for mental health is seen as a sign of strength, not weakness. By doing so, we can create a more supportive and understanding society. We must break the silence, challenge stigma, and create a world where seeking help for mental health is seen as a sign of strength, not weakness. It is time to change the narrative and support those who are struggling, and create a world where seeking help for mental health is seen as a sign of strength, not weakness. Together, we can make a difference and ensure that no one has to suffer in silence. For individuals living with mental illness, the decision to disclose their condition is deeply personal and often fraught with anxiety. On the one hand, speaking out can be liberating. Sharing their story can help break down stigma, connect with others, and advocate for change. Disclosure can also foster understanding and support from family, friends, and colleagues. However, the fear of negative consequences is very real. Discrimination in employment, housing, and healthcare is a sad reality for many. Individuals may worry about being treated differently, losing relationships, or facing prejudice. The decision to speak or stay silent is never easy. It's a delicate balance between the potential benefits of openness and the very real risks involved. There is no right or wrong answer. It's a personal choice that should be made with careful consideration and support. It's crucial to remember that individuals have the right to privacy. No one should be pressured to disclose their mental health status unless they feel safe and comfortable doing so. Creating a culture of openness and acceptance requires respect for individual choices and boundaries.